I am Professor Azizur Rahman, and today we are going to start a series of lectures on various imaging tests. Imaging plays an extremely important role in the diagnosis of various diseases, and we have many tools actually available. Since every imaging test offers something different, the physician has to choose the right one for the given condition. Some tests are readily available and are cheaper. Others are little expensive and are not readily available. So that is another reason why we need to understand which test can provide the information we need for the diagnosis. So today I'll just give you a very brief introduction of various imaging tests available. Of course, detailed discussion will be beyond the scope of internal medicine, and I will just be giving you very brief outline of various tests, and then we will take up the radiology part, the X-ray part, because that is the commonest test we do, and that is the one which is usually shown to you in the examination also. Out of X-rays, we will be primarily focusing on X-ray chest in this series of lecture, and today we will cover the normal X-ray chest. So let's have a very brief introduction of various tests available to us. Radiography is the other name of X-ray. Any part of the body can be X-rayed, particularly the bony parts. And in the chest, it plays an extremely important role. And then CT scan is an improved version, a more sophisticated version of radiology, and you can see the image in much better quality. When the CT scan came in, the first application was brain, because that was a part of the body which was not accessible to other imaging techniques, but now it is applicable to all body parts. And we have a separate lecture on CT scan and MRI. Then we have a series of tests called radioisotope scans. Now this is based on the principle of radioactivity. For example, if we want to image thyroid gland, and if we administer radioactive iodine, that will be taken up by the thyroid gland, and the thyroid will be outlined, and we can have some idea if it is normal size, or if it is enlarged, or if there is any what we call cold nodule or hot nodules. Similarly, these scans can be done on various organs, but they have relatively less resolution. And I think as we have other scans, radioisotope scans are losing their popularity, but they're still applicable. Then there's a scan called PET scan. This is actually positron emission tomogram, and this is perhaps the latest and the most sophisticated and most expensive one also. And this basically tells us about the metabolic activity in the body, usually those parts of the body which are otherwise not accessible. And it is usually used to detect metastasis and also some hidden inflammatory conditions in the body. Ultrasonography was the latest, one of the latest which came into the practice, but it has really replaced many other, because this is very cheap and it is non-invasive. It is available on the bedside and is not expensive at all, and any part, any soft tissue of the body like liver, kidney, spleen, ovaries, any part of the body can be imaged with ultrasonography. And the main limitation is that these sound waves, they cannot pass through the bone, so the brain cannot be imaged, at least in adults. MRI is another test. It is very much similar to CT, but it does not need radiation, so it is considered to be relatively safer as compared to CT scan, but it is much more time consuming and is more expensive also, and we have a separate lecture on MRI also. So at this level, I think the internists need to know that these are the imaging techniques, imaging tests which are available. So depending upon what you want to see, For example, if you want to see the lung condition, perhaps X-ray chest would be best. If you want to rule out a brain tumor, perhaps the MRI will be the best. And if there is a patient with stroke, perhaps CT scan will be the best. Now, if you want to rule out between thyroiditis and Graves' disease, I believe radioisotope scan can provide that information. If somebody has prostate cancer and you want to know if it has metastasized in the body, then the PET scan would be the best. So every test has got its role. We need to know them and we need to apply them when appropriate. The main thing which we consider is that the test should be done which is readily available and which is non-invasive. Of course, if the information you need can only be obtained from a test which is expensive or invasive, then we have to go for that also. Now, as I said, today we will be discussing normal X-ray test. Now, we actually, whatever condition, whatever imaging test we have to learn, first we have to learn the normal, because only then you can appreciate the abnormalities. So I'll just describe the normal X-ray test today, and of course in subsequent lectures we will be discussing common abnormalities. Of course, we cannot discuss everything because we have to have finished them in few lectures. Now, X-ray chest typical is, I think you are familiar with these two terms, PA versus AP. PA is postero-anterior and AP is antero-posterior. Now, this is the typical postero-anterior X-ray chest. Now, this means that the person is standing like this, and this cassette contains a film which is a radio sensitive film which will get the image, and this is the X-ray machine and this is the X-ray tube. This emits X-rays. They pass through air, and this is approximately 72 inches, enters the body from the back and then passes through the body and the lungs and the heart and everything, the soft tissue. Then the image is made here. Since radiation enters from the posterior and emits from the anterior, it is called postero-anterior. This is the standard film. Sometimes we have to do AP film, but unless specified, the X-ray shown to you would be PA film. And there is a reason why we prefer PA film, and I'll just demonstrate to you shortly. Now, this is the AP film. You can see the AP film. This is actually a portable machine, and the X radiation will enter the body from front, and the X-ray film is on behind. So this is AP film, and generally speaking, AP film is done only when patient is unable to stand up and go to the X-ray department. There are some other indications also, but this is the commonest. And the image quality of AP film is usually compromised as compared to PA film. Although now the technology has improved, we are getting good quality films in the AP X-rays also, but traditionally we would expect a better quality X-ray when we order PA film, because this is done with the main machine in the department of radiology. This is the portable machine done not under very ideal circumstances. But there's another reason why we always prefer PA film. Because one of the reasons to do an X-ray is to assess heart size. Now, if you understand this physics, this is the person and this is supposedly heart. Now, if you take the PA film, in this case, heart is very close to the film. So the magnification would be minimal. And if you take the same person, if you read the AP film, since heart is in the anterior part of the chest and it is much at a greater distance from the X-ray film, so there will be magnification. Now, when there is magnification, you can see if in the PA film you get 13 centimeter image, and the same object you will get 16 centimeter image. So the image shadow will be enlarged. Since one of the information we want to know on X-ray chest is heart size, So in AP film, heart will appear to be enlarged, whereas it actually may be of normal size. So that is why we want PA film, because the standard of normal is described on PA film. Another reason is when it comes to heart, because here there is magnification. Whenever an image is magnified, its resolution becomes compromised. So the image may not be as sharp in AP film as we expect in PA film, because this is closer to the heart. So that is why standard film is PA film, but in some situation you will be shown AP film. Now usually the X-ray need to be bearing a label showing if it is PA film or AP film, but there is a way you can guess also. I'll show you if we can figure out if the given X-ray is PA or AP. Before we give our comments on X-ray, I think we need to make sure few things. First of all, read labels. These days, everything is printed on digital film, because it is important to know to which person, which patient this X-ray belong. So that will be shown by the name and then date and then the side, right or left. It has become easy because these days the digital film, they have all this information available. Then the quality, any test, anything where you want to make a diagnosis, I think we need to have a good quality image. Only then you can make a diagnosis of finer diseases. Of course, even a poor quality film may show a gross abnormality, but if you want to rule out very subtle abnormality like miliary tuberculosis, then of course you need a good quality film. Quality actually relates to the exposure time and the development of film and the X-ray quality and the radiation given and the machine capacity. Then we need to know the view. Is it PA or AP? In some cases you will have lateral films also, and in some cases you would have oblique views. They will be labeled. And rotation. Now this is another thing which we want to make sure before we comment on the position of various normal structures in the chest. We need to make sure that patient is not rotated. And in next X-ray, next slide, I will show you what I mean by rotation. Now this is PA film and this is AP film. You can see if this is the same person, you can see this heart size is more real, and then but this one is slightly enlarged, just because the fact that this is an AP film. And this is, I think, better outlined as compared to this one. And if you see the ribs distribution is different. Here you can see the ribs are rather crowded and somewhat lifted. Here they are more spaced and they come downward. So I think that is the reason. And in PA film you see the spine, in AP film I think you see the spine even better. You may not be able to actually tell which one is PA, which one is AP, but this is how we tell. Now coming to the rotation part. Before we see the X-ray in detail, first we have to make sure that patient is not rotated. Now, if you can identify these small spicules, these central bony markings, here also, I think they're better seen here. This one, this one, this one. These are spinous processes of vertebrae. Now, they are supposed to be in the midline. Unless somebody has kyphoscoliosis, these spinous processes are in the midline. Now then these are clavicles. This is the right clavicle and this is left clavicle. These are easily identifiable. And if you identify the medial end of the clavicle on each side, now if you see this is the cursor, now this one corresponds to this cursor corresponds to the medial end of the clavicle on the right side, and now it corresponds to the medial end of the clavicle on the left side. So if the patient is not rotated, that means patient is standing straight against the X-ray film, then the distance between the spinous process and the medial end of the clavicle on each side should be the same. Now if that is the case, that means patient is not rotated, then midline structures like trachea should appear in the midline. And other structure, midline structure will also be seen in the midline. If patient is rotated, so you may not then comment on the position of the midline structure, or then you make appropriate adjustment. For example, if the distance between the medial end of the clavicle and the spinous process is more on the right side, patient will be described as rotated to right. And then trachea will also appear to be rotated to right, although it may be actually in the central position. So accordingly you make adjustment. So this is done. First of all, you make sure that patient is not rotated. Then you identify various normal structures. Now let's start from here. You can start from anywhere. So I think this may be a good point to start. First, identify trachea. This black column. Now this black column is trachea. Now I'm sure you all know the basic principle that on X-ray, whatever is dense is shown white. Heart, for example, bones, liver, all radiodense structures are shown white, and all translucent structures are shown black. Now, this is, for example, air. This is shown black. Now, this is outside the chest. This is jet black. So you would see various grades of gray, from absolute white to maybe jet black here, but you would actually see various grades of gray, and that actually determines the density of the structure. A computer can determine more shade, but human eye can only appreciate, I think, about 16 grades of the shades, different grades of gray shade. Now this is blackish. Now this is trachea. You can see the normal size, and at this point it bifurcates into left main bronchus and the right main bronchus. It is more obvious here. This is the point where it bifurcates. This is called carina. You can see the left bronchus and the right bronchus. Right bronchus is somewhat straighter. Left bronchus is maybe on a little angle. That is why when somebody ingests a foreign body, it is more likely to go to the right side. So this done, now you identify the ribs. First of all, you have to identify the first rib. Now this one, of course, is the first rib. How do we know this is the first one? Because this is first in the line from above. This is the first rib, and this is the posterior end. You first trace the posterior end of the first rib, and then you trace it forward like this. This would be anterior end. You know, as it comes anterior, the structure, the shadow of the rib becomes a little faded. But this is where this is the anterior end of the first rib. Now, if you want to know which one is the second rib, then you have to come from the first, and then this is the second. The second rib, this one is the second rib, and this is the anterior rib. Now, there is importance of second rib. If you draw a line, horizontal line like this one, imaginary line, which runs across the lower border of the anterior end of the second rib, this defines the lower boundary of upper zone. So area of the lung above this would be called upper zone. And then you, this is the second, then the third, then the fourth. So you trace fourth rib, and then you again draw a line, imaginary line. This would define the lower boundary of middle zone or the upper boundary of lower zone. So these three zones on both sides, upper zones, middle zone, and the lower zones, they are territories, and this concept is applicable to X-ray only. This is not on human. So this is actually an arbitrary division of X-ray territories just to make it possible to describe an anatomical place for any lesion. Another importance of this zone is that there are certain diseases which tend to occur in certain zones. Tuberculosis, for example, typically affects apices, upper zone, and if there is free fluid in the lungs, pleural effusion, that will first of all accumulate in the lower zones, in these recesses, and hilar lymph nodes, since they are in the hilum, so they would appear here in the middle zones. So this is the concept. Let me repeat. The division between upper and middle zone is the lower end of the lower edge of the anterior end of the second rib, and then the demarcation between middle zone and the lower zone is the lower edge of the anterior end of the fourth rib. Alright, so you have seen this, and now you, I think, examine the chest cage on both sides. So if I look at this one, I don't see any problem. Chest looks like normal shape. This is the normal shape of the chest, and there is no deformity, no fracture, no erosions. I don't see any problem at all. So after seeing the chest, then come downward. Appreciate these two angles. The most dependent part on the X-ray chest in PA film are these angles. This one is called costophrenic angle. Costophrenic, and this term is, I think, self-explanatory. Costo means chest, phrenic means diaphragm. So this angle between chest wall and the diaphragm is called costophrenic angle. This is the right one and this is the left one. And these angles are usually very sharp because there is no fluid here. So you need to see them, and they are normally expected to be very sharp. Then you can trace the diaphragm. This is the right diaphragm, right hemidiaphragm, and this is the left hemidiaphragm. On this side, right hemidiaphragm and the left hemidiaphragm. This is actually the diaphragm. So, and the left hemidiaphragm. Normally, right hemidiaphragm is slightly at a upper level, slightly at a higher level because of the presence of liver underneath. And the second difference is that the right hemidiaphragm, it casts a uniformly dense shadow, usually. In the left side, usually there is air in the stomach and in the colon. So this, where my cursor is, this is the air in the stomach. This is air in the stomach. And this one is air in the colon. This is the air in the colon. So you need to identify these structures. So when you come medially, this is cardiophrenic angle. Again, it is self-explanatory. Heart and the diaphragm. This angle is cardiophrenic angle on the right side. This is cardiophrenic angle on the left side. Then you can go upward. This is right cardiac border. Right cardiac border is only slightly lateral to the vertebral column, right? And left cardiac border is this one. So right cardiac border is made by the right atrium, and the upper part may be by the ascending aorta. Ascending aorta is not seen here, but you can better appreciate it here. This part, this convexity is caused by ascending aorta, because this is left ventricle. The aorta goes like this up and makes an arch and then turns like downward. This is called aortic arch. So, and then you can see this border which runs parallel to the spine. It is actually descending aorta. You can see it very clearly up to this point. So you can trace the heart, left cardiac border, right cardiac border, and the aortic knuckle. So when it comes to heart, you are actually interested in three things. One, the position of the heart. This is the normal position. 2/3 of the heart is on the left side and 1/3 is on the right side from the imaginary midline. If you draw a line here, 2/3 of it, the heart will be on the left side and 1/3 will be on the right side on this one also. But there are actually exceptions, but this is the general rule. The second thing in the heart you want to see is its size. Now normally heart size, and this concept is applicable to a PA film. Now if you draw a horizontal line at the maximum transverse diameter of the heart, in this case from this point to this point, I would show this in another X-ray when there is a cardiomegaly, but just imagine that you measure the maximum transverse diameter of the heart, and then you measure the maximum internal thoracic diameter. Now it has to be maximum and internal thoracic. Now you have to count from the medial side of the ribs, not outer side, and you will of course not include the soft tissue. So from this point to this point, And the normal heart size should be less than half of the maximum thoracic diameter. So that if that is not fulfilled, that means that is cardiomegaly, and there are various conditions which are characterized by cardiomegaly, and we will discuss them in detail later. And third is the position of the heart. If it is on the left side, normally heart is on the left side, but occasionally it may be on the right side in a condition called dextrocardia. Another thing is actually the silhouette, the outline of the heart. Normal heart is just like this one. Now if you trace from above, first you see one prominence which is caused by aortic knuckle. This is the aortic knuckle, and sometimes you may see calcification here, especially if the X-ray belongs to an elderly person. This rounded shadow is aortic knuckle. Then there is a concavity, and there are two structures which make this concavity. One is the pulmonary artery, and then is the left atrium. Now whenever pulmonary artery and left atrium are dilated, then this concavity will be straightened up, and then it will be replaced by convexity. We will show you the X-ray, but in this X-ray just appreciate that there is a normal concavity, and then there is a convexity due to left ventricle. This is the left ventricle. Okay, so this is a normal heart size and normal heart shape. Please appreciate that. And then comes to the hilum. In the hilum, normally we do not see the hyaline nodes in normal person because they're very small and they are hidden behind this heart and mediastinum. But if they are large, you will see the hyaline nodes popping up from this side and this side, and I will show you some X-ray. This one is normal. Okay, so we have, I just told you the scheme. So if you are shown an X-ray, first I think spend few seconds to make sure that everything is normal. And if you see an abnormality, I guess once you have read the X-ray to yourself, then I think start describing the abnormality after just making one statement. This chest, this is an X-ray chest, PA film, and this shows a particular opacity if there is an opacity, right? So I think do not spend too much time in describing normal things, because examiner wants to know if you have picked up the abnormality or not. After maybe just one sentence, you straight come to the opacity. Now in X-rays, I always recommend that first you describe what you see. First you describe the opacity. X-ray usually shows opacities, and then you first describe it, and then you draw a radiological conclusion, and then you draw a clinical conclusion. For example, if there is a rounded opacity of whatever size on the right side, left side, apex, you describe that, and then you say it is like a tumor, and then you make further judgment. Okay, now let's move on. Today I'm going to show you the normal X-rays only. Now this is the PA film versus lateral film. Lateral film, of course, you can identify, and as compared to the PA film, this is the lateral film. Now in this film you can see the spine. It should show a curved structure like this one, because this is the thoracic spine and it is curved like this. You can identify various vertebrae and intervertebral spaces, but if you are really interested to know any pathology with vertebrae, then you actually have to order an X-ray for spine. But you do see vertebrae in this lateral film also. Now this is the diaphragm. You can see two diaphragms actually, both overlapping, and you can see the stomach bubble also. And you can appreciate that this the most dependent part of chest is actually the posterior connection of the diaphragm. So it is possible that if there is an effusion, the PA film might not show it, because this is most dependent part, but only in this PA film. But if you take the lateral film, and this is perhaps the most dependent part, so fluid will accumulate here first, and later on when it rises above this level, only then it will be seen on the PA film. So what is the importance of this concept? that it is possible that a small pleural effusion is seen only on the lateral film and not on the PF film. Of course, now we have other techniques also, like a small effusion can be determined on ultrasound if X-ray doesn't show it, but one way is to do an lateral film. Which lateral? There could be right lateral film, there could be left lateral film. Now it depends if you have seen some pathology on PF film and you want to know more about that pathology, especially its exact location. Because if the opacity is, if you see an opacity here, you can't really tell if that pathology is anterior part or the middle part or the posterior part of the lung. So for that you need an X-ray with the lateral film. This is a normal lateral film. You can appreciate two opacities. One is this in the lower part and the anterior part, and this is caused by a normal heart. So this is heart. Of course, in cardiomegaly, the size of this opacity will increase. So this is the normal opacity caused by normal heart. And this part is also opaque because this is caused by shoulder. But then we have two translucent areas. This is the one which is called a retrosternal. This whole thing is retrosternal translucency. And this is retrocardiac translucency. These two translucencies are usually same size, but they could actually increase in emphysema. So you can appreciate these two translucencies and these two opacities. If there is an opacity here, and then we can make different diagnoses depending upon the size and the shape and the other features of that opacity. So I'm sure, I hope that you are now familiar with the lateral film also. This is another X-ray chest. This is the L. L means this is the left side, and you can see the spinous processes, and you can appreciate the medial end of both clavicles. Since the distance between medial end of the clavicle on the right side and the spinous process is the same as that on the left side, so this patient is not rotated, and trachea does appear in the central part, that's in the center, and you appreciate both clavicles. I think in this X-ray, I was trying to explain to you how to count ribs. This X-ray chest is more clear. This is the first rib, you can see this is the first rib, and from this point, and this is the second rib. From this point upward, there is upper zone. This is the third, this one, third rib, and fourth, and fifth, and sixth, and seventh, like this. I don't see any problem with the chest cage. It is normal. There is no problem in the costophrenic angles. It is clear. No fluid accumulation. No fluid accumulation. Absolutely normal contour. Right hemidiaphragm. Same here. Left diaphragm and the gastric bubble. You appreciate the left hemidiaphragm is at a slightly lower level, and then you can see the vertebral column. You can see the right cardiac border, you can see the left cardiac border, and if you trace from above, this is aortic knuckle, descending aorta, this is concavity caused by left atrium and pulmonary artery, first pulmonary artery, then left atrium, and then this is left ventricle. Right side, this is ascending aorta and aortic knuckle, and this is the right atrium. So heart size is normal, and I think these are the normal breast shadows. So this is a normal thing. You please do not confuse this with some opacity, because from their contour you can tell these are normal soft density shadows. And then these are medial, these are scapulae. This is the medial end of the scapulae on the left side and right side. So all these structures are normal. Let's see another one. This is again a normal X-ray chest. Here you can see the patient is slightly rotated. Now I think I'm glad I have got this film. This is the spinous process. Now you can see that this is a right clavicle and this is the left clavicle. So distance on this is more, and that is why trachea appears to be slightly deviated to the right. Actually, trachea is normal. You see this column, this black column, you can see more of it on the right side of the spinous process, as if trachea is moved to right, but actually this just appears to be deviated, but actually it is not. Okay, so this is the importance of rotation. You can see the trachea, you can see this is the bifurcation, very clear left main bronchus, very clear right bronchus, and these are pulmonary shadowing. This is the last, this is not actually first rib, this is the lateral process of the last cervical vertebrae. This is the first rib, and then you can see the other ribs. Costophrenic angles normal, both sides. Diaphragm normal, both sides. Cardiophrenic normal, cardiophrenic angles normal. Then aortic knuckle, aorta, left cardiac border, right cardiac border, everything normal. You see these pulmonary markings, these are called pulmonary markings. This X-ray, the lung fields are not absolutely characterless, because lung also has parenchyma. Lung is air with parenchyma, so you will see these small markings. Now you have to see multiple X-rays to make a good impression how much of these shadowing is normal. If there is too much of these shadowing, that could be a manifestation of some disease. But this one is normal. So I think you need to familiarize yourself what is normal and what is not. And the only way is to see multiple X-rays that will print the impression in your mind. Now digital X-rays, they show more pathology. Those who were trained earlier on the conventional film, and when they are shown a digital film, they sometimes feel that there is too much on the X-ray. That is because these digital films, the more sensitive technology, they show more shadows, but that does not mean that there is more pathology. So let's see another one, and we are getting close to the end of this presentation. This is another normal X-ray, and you can see the pulmonary markings are slightly more pronounced, but otherwise it is the same. I will not go into the details, but this X-ray is again an example of normal. No problem with the heart, no problem with the chest cage, no problem with the diaphragm. And of course, a normal X-ray chest does not rule out all the pathologies. You have to correlate with clinical condition. There may be something serious going on in the lungs, and X-ray may not show it, or X-ray may show something which may not be clinically relevant. So you need to correlate. Always, that's a very, very basic principle, that you have to correlate the radiological finding with clinical condition to reach a right conclusion. This is another normal film. You just appreciate the rotation. This patient is not rotated. These are normal spinous processes, normal clavicles, normal ribs, normal chest wall, and normal diaphragms, normal costophrenic angles on both sides, normal cardiophrenic angle, normal heart, aorta and descending aorta, normal left cardiac border, normal right cardiac border, normal heart size, slightly more lung markings here. Maybe this patient is a smoker, or maybe just normal. And then again you can see the breast shadows. This is again a female X-ray. So this was it, and thank you very much. I showed you multiple normal X-rays, and I just hope that you have learned what is normal. And of course, the best way to learn what is normal is to see as many normal X-rays as you can. There is a lot of variation even within the normal range, so you have to familiarize yourself with all the normalities, and then only you can pick up the abnormalities. This has been Professor Azizur Rahman from Medurstand, and I really look forward to see you in my subsequent lectures, which is going to cover all common X-ray abnormalities. Thank you very much.